I started dealing with the COVID-19 patient since May of 2020. I was initially involved in a screening of healthcare workers at my hospital and did some arrangement for both PCR and RTK swab testing in our hospital. PCR stands for polymerase chain reaction and RTK stands for rapid test kit, but later on was selected and sent to Sabah, a state in East Malaysia, to help out with COVID-19 patient management there. After serving for a month, I came back to my own hospital and continued with COVID management in my hospital in Seremban Negeri Sembilan. The difficulties that we faced as frontliners are, first of all, during the screening, some of our patients were unwilling to give us correct information about their whereabouts and their contacts, which later on exposed us, the frontliners, to the danger of transmission of COVID-19 virus, also at workplace as well as in screening booths. Secondly was convincing our patients for the need of swab taking. Some of them were unwilling for the swab taking due to the fact that discomfort caused by the swab taking itself, and some were due to religion reasons. Besides that, for the frontliners who were traveling to remote areas for screening and swab taking, we were exposed to other types of diseases, infectious diseases such as malaria, due to malaria and dengue, and also due to foodborne diseases such as gastroenteritis. So as a frontliner, we will be wearing PPE, personal protective equipment, for prolonged hours, which will lead us to dehydration because we will be sweating very profusely inside there, and also exhaustion because of prolonged standing for swab taking and also history taking from the patients or the public that we are screening. As for youngsters, there were and are many who are diagnosed with COVID positive, mainly due to their exposure to your family members who are COVID positive. There were also large group of secondary school students who were exposed to their teachers, which has been diagnosed with COVID-19 infection, and which later on, after screening, we found out that they too have COVID-19 infection. There were also a small group of youngsters diagnosed with the COVID-19 infection after participating in events such as weddings and also in outdoor activities or indoor activities. Outdoor activities they were playing football, there are few, and also indoor activities such as with COVID positive. Some reacted with a shock, they were shocked, and some even started crying because they were scared about this infection. There were some just giggled, and we even heard that they're saying, we don't have to go to school after this because since we got the infection from the school. Yeah, okay. During isolation, for the first few days they were normal. But as it approached the second week of isolation, they started to get restless, and some of them got noisy since they had their mobile phones with them. Generally, their mental well-being were disturbed in minimal, because the isolation is only for 14 days, 14 days, 2 weeks. But it was not to the extent of causing any kind of trouble in the isolation ward. Youngsters were able to follow rules during their stay in the isolation ward, but some of them became a bit rebellious roughly about day 8 or day 9 of their stay there, mostly due to the restlessness they had inside the isolation area. There were not much activities inside the isolation area, and each patient were placed about 1.5 to 2 meters away from each other. As for youngster fatality, I came across one news. This patient was a teenager with tuberculosis meningitis and hydrocephalus, and also had contracted COVID-19 viral infection. So the diagnosis was COVID viral infection with tuberculosis meningitis with underlying hydrocephalus. So despite all efforts in ICU, this patient passed away at the age of 14. Yes, I came across many youngsters that were suspected of viral infection but refused a swab test, mainly due to the fear of pain and bleeding caused by the swab test itself. And there were some who refused for swab tests because they were afraid that their test results would be positive and they must be admitted to hospitals. My personal advice to both youngsters and general public out there is, first of all, please do follow all the SOPs and rules advertised by our Ministry of Health. Adherence to these SOPs are the main factors which will enable us, both public and healthcare workers of government agencies, to overcome and defeat this pandemic together. Remember, prevention is better than cure. If you are mentally depressed during this pandemic season, there are a few options. First of all, the closest, family and friends. Approach a person that you trust the most, share your concerns and get their advice. In this way, it might help you to overcome this. The next option will be approaching professionals, such as psychologists or psychiatrists. Approach a psychologist, get an appointment. Since this is a pandemic season, there might be an option of online sessions. You can speak to them, get their advice, and this might help you to overcome your problem, your depression. Next will be psychiatrists. Psychiatrists are doctors who are trained or professionals who can help you with mental health issues. It does not need to be mental illness. Depression is just a small problem, can be solved, and they are the professional doctors who can help you. Approach a psychiatrist, get their advice. There are many options. There are options that you can consider, and by that way, it might help you to overcome your mental depression.